to give you a little bit of history of what happened before COVID. In 2012, Health Canada mandated the flu vaccine, and they implemented the vax or mask policy. That meant that if you didn't get the vaccine, you had to wear for the 6-month flu period a mask. In 2015 and 2018, the Ontario Nurses Association went to arbitration and won both times that they were not to get the vaccine or the mask. I want to let you know that in 2015, Bonnie Henry actually was one of their key witnesses. And she stated, there's very scant evidence about the value of masks in preventing the transmission of influenza. I also want to bring attention to you that we have been scared by our government repeatedly from 2003 with SARS, 2004, the avian flu, bird flu. It's making a comeback. Did you all hear about it? In 2009, H1N1, 2014, Ebola, 2016, Zika, and 2020 was Corona. I want you to understand the definition of a virus, and I have brought my Merck manual here so that you can have a look. And this manual has been around since 1899. Viruses are defined in the first sentence as the smallest parasite. I want you to understand why ivermectin and hydroxychloroquine were banned, because they kill parasites. This would have ended the pandemic. I also want you to be aware in 2018, the definition of a vaccine was changed, and I want you to ask yourself, why? We have always treated patients regardless of how they show up at our emergencies. Did you see healthcare professionals dying in droves in 2020 in the hospital? Were they scooping them up with shovels and putting them to the morgue? Did you see patients dying and littered through our halls? No. I was at the hospital here in Vancouver Island that was the center for COVID patients, and I can tell you it was a ghost town.